Have you seen many news headlines lately talking about measles and you've been wondering if this is something that you should be worried about? I'm Dr. Katrina Coulter. I'm an infectious disease specialist and I make educational health videos. And today I'm going to educate you about measles, also known as rubeola. This was a virus that in the United States of America we declared eradicated in 2000. But unfortunately, we've continued to see outbreaks. And so I want to get into what this disease is and how you can prevent it. But first, I think it's appropriate to share a letter written by the author Ronald Dahl. Ronald Dahl wrote famous books that you likely know, such as James and the Giant Peach, Matilda, and Charlie and the Chocolate Factory. And unfortunately, in the 1960s, he lost his daughter Olivia to measles. So in the 1980s, he wrote this very touching letter that I'll read to you now. Olivia, my eldest daughter, caught measles when she was 7 years old. As the illness took its usual course, I can remember reading to her often in bed and not feeling particularly alarmed about it. Then one morning, when she was well on the road to recovery, I was sitting on the bed showing her how to fashion little animals out of colored pipe cleaners. And when it came her turn to make one herself, I noticed that her fingers and her mind were not working together and she couldn't do anything. Are you feeling all right? I asked. I feel all sleepy, she said. In an hour, she was unconscious. In 12 hours, she was dead. The measles had turned into a terrible thing called measles encephalitis, and there was nothing the doctors could do to save her. That was 24 years ago in 1962, but even now, if a child with measles happens to develop the same deadly reaction from measles as Olivia did, there would still be nothing the doctors could do to help her. On the other hand, there is something today that parents can do to make sure that this sort of tragedy does not happen to a child of theirs. They can insist that their child is immunized against measles. Ronald Dahl. So I feel this topic is important because we can have some pretty severe outcomes to measles, and I want everyone to be aware of them and understand what they can do to prevent them. Measles is a virus. It's spread through the air from respiratory droplets, and this is a highly contagious virus. Usually people will develop symptoms about 10 to 12 days after they've been exposed, and symptoms are typically a fever, runny nose, red inflamed eyes, and a cough. Then 3 or 4 days after those symptoms develop, we'll see a classic rash. And this rash starts on the head and then spreads down to the rest of the body. And at first it's kind of little red dots that then merge together into confluent big red splotches. There's also a classic finding called the Koplik spot or Koplik spot. And these are tiny whitish blue little dots on the inside of the cheeks. Other things that we might see are diarrhea, vomiting, abdominal pain, or enlarged lymph nodes or enlarged spleen. And on laboratory testing, we might see low platelets or a low white blood cell count. Now, many people will ask, so what's the big deal? If people were born earlier than 1957, they likely experienced measles. I know that my parents did, and they overcame it without any difficulty. And so I often get that question, well, what's the big deal? Isn't natural immunity better? Why don't we just let it run its course? And the big deal is that there can be some really devastating neurologic consequences that occur. And although they don't occur in everyone, if you happen to be the one they occur in or your child is, it could change the rest of your life in a very not good way. So some of the more common secondary complications that we are going to see after measles runs its course, which is going to be about 12 to 14 days, is someone could develop a bacterial pneumonia, bronchitis. In pregnancy, we can often see miscarriage or early term labor. And then we can see some really, really awful stuff. And that's what I want to talk to you about and make sure that you are well aware of and well informed on when making your decision about how to prevent this disease. 1 in 1,000 people will develop what's called encephalomyelitis, and that means inflammation of the brain and the covering of the brain. And this results in neurologic changes. So they may be related to speech or gait or hearing. And these neurologic changes are going to be permanent in about a quarter of the people that develop the encephalomyelitis. Another quarter of the people that develop this will die from this. The primary encephalomyelitis will be caused by the virus itself, but there can actually be a secondary encephalomyelitis that's caused by your own immune system overreaction to the virus. A little bit less common, but also very scary, is something called measles inclusion body encephalomyelitis. And this has a much higher mortality. About 75% of people that get this will die from it. This happens a year after the measles. And this happens in immunocompromised patients. So people whose immune systems are depressed for whatever reason. And then there is something even scarier to me called subacute sclerosing panencephalitis. And this one occurs 7 to 10 years after the measles. So after the virus and the experience has been long forgotten, we can see progressive mental status changes or cognitive decline, where somebody may have speech disturbances, gait disturbances, they might have seizures, visual changes, it might just be behavioral disturbances. And this will progress into a persistent vegetative state. They will become a vegetable. So this is really scary, and this is something as a parent I would absolutely want to avoid for my children, and I would feel very awful if this occurred and I knew that it was preventable. This is rare. It's only 1 in 300,000, but if your child is one of those, this is going to change the rest of their life. So what can you do to treat it once you get measles? Well, unfortunately, there's really not much to do. We usually just have to let it run its course. Patients are considered contagious for 4 days before they develop the rash and 4 days after they develop the rash. And so if somebody does have this, they need to be quarantined. But how can you prevent it? How can we not get there in the first place? Well, there is a very effective vaccine available that has been available for years. It's called the MMR, or Measles, Mumps, and Rubella vaccine. And this is part of our childhood vaccination schedule in the United States. Kids are supposed to get this as a first dose between the ages of 12 and 15 months, and then as a second dose between the ages of 4 and 6 years. And adults that were born before 1957 generally are not recommended to get this, but if they were born after 1957, it's recommended that an adult get at least 1 dose. Please know that over time, your immunity from the vaccine can go down, and you can check titers to see if you still have immunity to measles, mumps, and rubella. And I remember one of my first jobs in healthcare actually was contingent upon me proving my immunity. And so I had to get a booster because one of my titers of these 3 things had declined enough that I was no longer considered immune. The efficacy of this vaccine, how well it works, is fantastic. It is 93% effective with 1 dose and 97% effective if you've gotten both doses. So that's pretty impressive for a vaccine. Now, what's the downside? Well, this is a live virus vaccine, and so not everyone can get a live virus vaccine. Specifically, if you're pregnant, it is not safe to get a live virus vaccine. And if your immune system is weakened because of cancer, such as leukemia or lymphoma, or something like AIDS, which is advanced HIV. Now, persons living with HIV that are well controlled on antiretroviral therapy absolutely can get this vaccine. It is safe for you. And if you're thinking about becoming pregnant, I would really consider making sure that your titers are up to snuff and that you have immunity against this. Right now in the United States, we're at the tail end of winter and we are having a big outbreak. I believe we have 164 cases. Currently, 7 states are involved, and 95% of those cases are unvaccinated. Very sadly, we've had 1 death so far this year from measles, and it is only the month of March. And so this is heartbreaking. This is devastating. I would really love to prevent any further deaths or severe devastation from neurologic complications from this virus. So if you found this helpful, I have a big ask. Please share this with 3 people that you either think need to hear this information or that will help spread the word. Also, please hit the like button, subscribe to my channel for more information upcoming, and check your vaccination status and consider boosting it if you are suspicious that you don't have immunity, or you can find out from your healthcare provider with the titers that you do not have effective immunity any longer. Until next time, stay safe.